Okay, so I'm going to go over some information about temporomandibular joint dysfunction, or TMJ dysfunction. We've gone over this before, but I think it's a good review. We don't see it a lot, but in case someone does come in, that we get a referral for it, so everybody knows what to do. So the TMJ joint is the articulation between the jaw and the skull, okay? And it's made up of the mandible, which is your jawbone, okay? Your temporal bone, which is part of the skull, and then there's a disc in between those two bones. It's the most commonly used joint because we're talking, we're eating, we're chewing gum, all that sort of thing. So it gets used about 2,000 to 3,000 times per day. And it's actually fairly prevalent that people have TMD or TMJ dysfunction. About 10 to 15% of the population actually has TMD, but only about 5% actually seek treatment for it. And about 16 to 65% of people that have TMD have like an audible, like popping or cracking type noise that they get in their jaw. It is more common in females than it is males, about a 4-to-1 ratio. As far as the joint itself goes, the resting position for the TMJ is with the teeth slightly apart, but with the lips still together. So your mouth isn't actually open. Your mouth would be closed with your teeth just slightly apart is the resting position. And then opening of the mouth. So the way the joint works is it kind of rotates and then glides. So the first 10 to 25 millimeters are just rotation. And then the final part of the range of motion, which is up to about 50 millimeters, is actually like a glide or an anterior translation of the mandible within the temporal bone. And when that occurs, you also have translation of the disc along that mandibular condyle. Now, there's about 3 different main causes of TMD. One, which we are actually really qualified to treat, is going to be posture. So people that have that like forward head, rounded shoulders type posture. That causes an increased compressive force on the TMJ, and there's also like an improper resting position of the joint. Now, the second thing is going to be muscular. Obviously, that's also our wheelhouse, being physical therapy. So what happens is the muscles around the joint become very, very tight or hypertonic. You can get like a spasm of the masseter muscle, which is a big muscle on the side of your face here, or your temporalis muscle up here by your temple, and also your pterygoids, which are more like on the under part of your jaw. So it can be any one of those muscles, or it can be a combination of all of them, which I've seen a couple of times in here and had good results treating those patients because that's, like I said, muscles is what we do. And then the last thing, which I have actually not had a patient with this problem yet, but it's an internal derangement, meaning that there's a problem with the disc. These are the people that are going to have the popping noise. Because what happens is there's a displacement of that disc, and sometimes it will reduce back, meaning the disc will kind of pop out and then pop back in on its own. But then there's other times where the disc will pop out and not go back in. Those people are going to have extremely limited motion. They're going to be the ones that they may have a history of popping and clicking type noises, but when they come to see you, if that disc has not reduced back, they're not going to be able to open or close their mouth very much. It's going to be very limited. Versus the other group, where if it's just kind of subluxing back and forth, it's popping in and out, back and forth, they're going to have the noise, but they probably won't have as marked of a decrease in the range of motion. So that's just kind of some general information about TMD. We're going to do a second video that will go into the evaluation part, which will be more for the physical therapists. Okay, so that's it for this one.